What is an audiologist? It's a question we get asked a lot. One time somebody asked me if I worked on Audi cars, the Audis. That's not it. Someone else asked me if I was in like the audiovisual world where I maybe installed speakers into home theaters, and I don't do that either. An audiologist is a professional that has had completed college and has a degree. The entry-level degree is a doctorate, so it's a doctorate of audiology. And we have to have 8 years of training. So it's going through classes, learning about the anatomy of the ear, how hearing works, how sounds and acoustics work, how devices work. There's a whole gamut of things that we have to cover during our studies. And after that's completed, we have to spend at least a year under the supervision of another audiologist to confirm that we know what we're doing and that we're doing the job right and it's working well. So that's basically what an audiologist is. You may also see hearing instrument specialist, or HIS. A hearing instrument specialist in the state of Missouri has to have a minimum of an associate's degree, and they have to complete an online program. They also have to have specific hours under another licensed professional, and then they pass a test at the state level. So there's a bit of a difference between the education of a doctor of audiology and a hearing instrument specialist. An ear, nose, and throat just focuses on the ears, the nose, and the throat. An otolaryngologist, they go through much more extensive training than audiologists do. And their specialty is looking at the medical side and what we can do to help hearing, to help people hear better, to help you breathe better, all of those head and neck issues that may happen. So what's our role? If you're having issues with hearing, you would start off with an audiologist or a hearing instrument specialist and have a diagnostic hearing test. If you want it to be the diagnostic test, then you would want an audiologist to review it to see if there's something medically going on that it needs to go on to a physician, like an ENT. The ear, nose, and throat doctors typically don't test hearing. Generally, there's an audiologist that's going to do that. It's normally not a nurse, but it's another trained professional that's going to be conducting that testing. And our goal is to give the ENT, the ear, nose, and throat doctor, the information they need to make an informed decision so they can decide what your next step is. Do you need an MRI? Do you need an X-ray? Do you need a medication? Do you need a surgery? And they're going to decide what course of action needs to occur. When the audiologist looks at the hearing test and they don't see any issues that are medically causing the hearing problem, we can confidently say that no referral is going to be helpful. There's nothing that can be done. There's no medication, surgery that's going to improve the hearing. And then we move on and talk about hearing devices. Or maybe just, if your only problem is hearing the TV, maybe it's just something that connects to the TV so you can hear that better. If your only problem is on the phone, maybe we get an amplified phone so that it's louder and you can hear that better. So there's a wide range of things that we can do to improve whatever situation that's happening for you. But the main thing is getting that initial hearing test so that we know what the next step should look like. The audiologist and the ENTs work very closely together in ensuring that you are the most social, the most active, the best life quality that you can be. And that's what we do as audiologists and ENTs. So if you would like to have your hearing tested so you can see what's causing any trouble that you might be having, you can go to hearingcarepartners.com, where we listen so you can hear.